Good morning to all. I am Dr. Shalabh Gupta, Dean Academics and Head of the Department of General Surgery. Today I will be speaking on the history of surgery and its introduction. Surgery is derived from a combination of two words, chiron and argon. Chiron means hand and argon means work. So this suggests from the etymology of the word surgery. Surgery is a science and art, both the things. And the peculiarities of a good surgeon is 3H. He should have a strong heart, a strong head, and a strong hand. That means during surgery, he should think wisely, he should be meticulous in doing surgery with his hands, and he should have a firm and a strong heart so that he does not get deviated from the complexities of the surgery. And the qualities of a surgeon are these, like he has to be accurate, he has to be careful, concerned, motivated, disciplined, quick and efficient, and should be able to work under pressure and should be creative also. So it is very important to have a good surgeon with 3H and all these qualities that defines a good surgeon. So whenever we do surgery, there are four outcomes. Like the right operation has been performed well, the right operation has been performed badly, the wrong operation has been performed well, and lastly, the wrong operation has been performed badly. So meaning of these four lines is that the right operation means you have diagnosed the thing very correctly, and the diagnosis, according to the diagnosis, the procedure has been performed very well. Like appendicitis is there, you have performed an appendectomy and it has been done wisely. Right operation performed badly means diagnosis was right, but the operative technique, whether it's a open technique or a laparoscopic procedure, it has been performed badly. And there has been some kind of difficulty while operating, so the patient does not come out to be fine. Otherwise, if the right operation has been performed very well, that means that the outcome is good, but here the outcome will be bad despite having a correct diagnosis. Wrong operation performed well means the diagnosis was faulty, the patient did not have appendicitis, but you have performed very well. So there is no problem with the patient at all. So this is the third possibility, and the fourth possibility of surgical outcome is that the wrong operation has been performed badly now. The patient did not have appendicitis and you have goofed up in the surgery also. So the whole outcome of this becomes very, very bad for the patient. Surgery was basically coined in BC term. In 460 to 377 BC, there was a person known as Hippocrates, on which we take the Hippocrates oath also. And he had said that treat the patient, not the disease. So most of the time this statement goes true for from that time to today's time also, because what is the current scenario? We are treating the patient with their investigations. Like we see the ultrasound report and we start treating the patient. But he had said that treat the patient, not the disease. So that means that it is the kind of proper diagnosis, it's a kind of proper workup of the patient which has to be treated. First of all, do no harm. So the surgeon should not know only all the procedures have to be cut open. You have to also learn which are the patients which can be treated conservatively and those patients who need immediate surgery. So that's why there should be no harm to the patient. And third point which is said is observation is the first stage of physical examination. And he was very right in saying these things, because unless and until you observe the disease, you observe the patient and you come out with a good physical examination, then you cannot treat the patient properly. Celsus was the another gentleman who had come up with signs of inflammation. So signs of inflammation are tumor, he had said, which means edema, rubor, which is equivalent to redness, calor, which shows warmness or heat, and dolor, which says the patient is having pain. So these are all technical terms, Latin terms which he had described in his language, and the last term which he had described was functional lesio, that means loss of function. So these are the 4 and 5 terms which are associated with signs of inflammation coined by Celsus. Galenus had described the topographical anatomy. Topographical anatomy means at one point of the body what is the structure exactly lying underneath. So this means that this is very important because a person who has to operate should know what are the deeper structures. So topographical anatomy tells us in depth about the structure which are coming in the area of incision. Ambrose Payer was there from 1510 to 1590 and he is known as the father of surgery. The development of surgery was impaired due to the failure to act against bleeding, infection and pain. So these were the 3 things which were more troublesome. Whenever he used to cut, a surgeon used to cut, there was bleeding, and followed by once they used to repair, there was infection, and then there was pain also. So these were the limiting factors which had come up. So for pain, in 1846, William Morton had come up with the discovery of ether. So the surgery became painless. And then Joseph Lister had come with antisepsis. So he is known as father of antisepsia. And Louis Pasteur had come with asepsis. So he was known as father of asepsia. So life became more comfortable, surgeries became more comfortable and more safe. Joseph Lister existed from 1827 to 1912 and he devised a total sterile medium of surgery. So he used to put carbolic acid solution into the wounds so that the wound became sterile, and he used to use his hands after washing, and he had used sterile gloves also. So the instruments also were used with antiseptic solution. So he had devised these methods so that the surgery became almost antiseptic. Louis Pasteur in 1860 had coined the germ cell of disease, and he had told about the chemicals and physical agents which are needed to kill the bacteria. Also he devised sterile surgery techniques. Cocker was there from 1841 to 1917, and in 1909 he was given the Nobel Prize for his work on the thyroid gland. So his work was too expensive on thyroid gland, so that's why he was awarded the Nobel Prize for thyroid gland. And so many instruments are also named on Cocker, like Cocker artery forceps, and so many instruments have been named on Cocker. Then came the gentleman known as Theodore Billroth, who existed from 1829 to 1894, and he started doing gastrectomies. So 2 types of partial gastrectomies. First, Billroth 1 and Billroth 2 partial gastrectomies are known against his name, which he used to do for gastric carcinomas. Halsted was also a very interesting person, and he is known as a surgeon of high repute, and he was a very good diagnostician. He existed from 1852 to 1922. In 1890, he introduced the use of rubber gloves. So we are using rubber gloves till date, and it was because of his brainchild that we started having the gloves. And he's the person who coined Halsted radical mastectomy, and he also developed methods like sterile aseptic techniques, gentle handling of tissue, low tension on the tissue, and use of fine silk suture material are all his things which he has given to surgery. Now little bit about the different type of mechanisms by which we can get rid of the infectious agents. So the first term which is coined is asepsis. Asepsis is basically absence of any infectious agent. So the procedures for asepsis is that sterilization of goods and supplies is very important. Disinfection of the hospital environment is necessary. Antisepsis of the living tissue is also important, and environmental control of the operation room is also important. So these are the 4 principles of asepsis. Like whatever goods or instrument that we are having for which we are going to use for doing surgery, if they are metal or stainless steel instruments, they have to be sterilized. And this sterilization can be done with ETOs, it can be done with autoclaving. Disinfection of the hospital environment is also very important, because if the OT where you are working and adjoining areas where you are working, if they are all infected, then the patient is also going to get infected. Antisepsis is also important, and for environmental control of operation room, we take the cultures from the operation theater so that we can take proper control of the operation room. Sterilization is a process that kills all form of living matter, whether it's a bacteria, virus, or a mold. Mold belongs to fungi. So these can be just killed with a simple process of sterilization, and we need some special equipments, of course, for it, like physical or chemical agents are used. And for practical criteria, which is there for sterility, is the failure of microbial growth. So these days, once we do sterilization, we have got some indicators which can be placed on the top of that of the cloth where it is used to wrap it round along a particular device, and if the indicator changes its color into a particular color, that means sterilization is complete. Disinfection is a process of using a chemical substance on the surface of inanimate object. So disinfectant at lower concentration can be used as an antiseptic also. So once you have got those slabs, operation table, instrument table, floors, they are all cleaned with disinfectants, because once you are inside the OT, the environment has to be absolutely sterile. Antiseptics are those chemical agents, when they are put on animate surfaces, they will destroy the bacteria. So a good antiseptic is one which kills at lower concentration. There is no toxicity for living tissues. They will act for a long time, and they are not able to stain or have a bad smell, and it has to be economical also. So these days, so many antiseptics are available which are generally using. So these antiseptics can be used to clean the thing. So once we use these antiseptics, the concentration of the bacteria is almost nil. Inside the operation theater, we have got 3 P's, like we have to first shave, second scrub, and third is we have to drape. So the importance of shaving is basically removal of dirt and debris and the bacteria which are inhabiting in and around the hair or hair follicles. So that's why what we advise is we have to shave the patient inside the operation theater. So epilation or shaving, both can be done. Second part comes with the scrubbing. Scrubbing, what it does, it removes the dirt, debris, decreases the viscosity, and has got a soap-like action. So once it does, that means that it removes all the bacteria from the area which is to be operated. And third part is draping, that is presence of sterile sheets all around the surgical incision where you are planning a surgical incision. So you can just put the drapes all around, and then once you put the drapes all around, anywhere which you touch adjacent to the incision area is basically a clean area. That means, so if you turn your hand back to the operative field, it does not get infected. So the drapes are there with sterile cloths. So surgery is all about learning. Surgery is all about taking care of the patients. Surgery is all about being prepared. Surgery is active, and surgery is basically a fun. So you have to be very particular, precise, and do the surgery in such a manner so that you can enjoy the surgery. So the different type of surgeries which are available these days, you can become a general surgeon, you can become a vascular surgeon, in which the surgeries are all related to veins, arteries, and the heart. And then you can also become a plastic surgeon. Plastic surgeon is basically with grafting and with flaps and cosmetic surgeries. Orthopedic surgeon also you can become, which is concerned with the bones. Oncology with carcinomas, and transplant surgery is basically organ transplantation. ENT surgery with ear, nose, and throat. Cardiac surgery you can take if you are interested with CTVS kind of problems. Neurosurgery you can take with brain surgeries. Similarly, colorectal surgeries, pediatric surgery also can be taken up. All it depends on your interest in which field you want to enter. So many surgical options are there, including thoracic, trauma, endocrine, urology, ophthalmology, minimal invasive surgery, and gynecology. Of course, orthopedic surgery is a totally different branch from MS general surgery, and pediatrics and gynecology are also totally different branch along with ophthalmology. Otherwise, rest of the branches can be done under general surgery. After doing general surgery, you can specialize, super specialize in these branches. So surgery is not hurrying on something. It is basically a cool down, and once you are cooled down, you will be able to do justice and the patient will be safe. So before the start of the case is there, you have to become prepared with the case. You should know all about the anatomy. What are the things, if there should be a plan B, if something is there inside and some kind of thing which comes out which you are not expecting. So come prepared with patient information. Do not operate a wrong patient. And then you should be thoroughly sure about the anatomy and physiology. And once you come in the operation theater, if the patient is conscious and he's being operated under full 100% consciousness, you have to introduce yourself and team, and then you have to pull your gloves so that the patient is also comfortable and has got faith in you. And it is important that you have to be on time. It has been a normal thing that surgeons don't come on time and they are late. So you have to be disciplined and start the surgery on time, because other specialties are also waiting, like anesthesia, the OT technicians, nursing staff. They will all come and prepare, but you have to be disciplined and come on time. And once inside the operation theater, you have to respect the patient, because these patients are scared. Patient may be awake, and if ask if you should introduce yourself to the patient. Always tell them your team members are these, and these are the people who are going to give you anesthesia. This is the person who is going to do the surgery, so that the patient is not scared and he becomes comfortable. Once you are there inside the operation theater like a student, it is best to speak when prompted. Don't make some kind of exclamation marks, because the patient may become tense if you speak in between. And don't ask questions during critical portion of the case, because at times we are in difficulty, we are thinking, and then if you ask some question at that time, it disturbs you. You can ask the question, of course. There is no, you should always ask questions, but not at critical times. And limit your conversation to case related talks only. You should not have some loose talks and laughter or some kind of exclamations during the surgery, and you should hardly talk inside the operation there unless and until it is related to case related talk. You should avoid any other conversation. So it is important what not to say in the operation theater, because it is very important that you have to be absolutely conservative and you have to be professional. So you should learn what not to say. And in the initial part, when the students come over here, you may feel sick, because sometimes because of vasovagal syncope, you are basically having some kind of vertigo. So at that time, if you are feeling sick or you're feeling nausea or you're feeling some vertigos, it is better to move out of the operation theater and take some rest so that you recover. And then once you are feeling okay and have some good water and breakfast, then you can come back. For the surgeons, it is important that you have to take some break during long cases, otherwise you will feel weak. So that's why it is very important for you to take a break during long cases. So why do you think the surgeons have got the coolest job in the hospital? Because they operate on all the organs, whether it's an abdominal organ, like these organs like spleen and liver can be operated. And this is a photograph of a trichobazar. Trichobazar is basically here in the stomach. So all the psychiatric patients who are suffering from this disease have got some kind of habit of eating up here. So you have to take out the whole of the stomach which is infested by such kind of hair. So you can take out, and these type of things are very exciting, and it is basically helping the patients to move forward with their illness. So these are some of the cases where you show that this is a whole amount of gut which has been removed. So that's why it is very important to be precise. It is very important that you respect the patient. So welcome to the Department of Surgery. It is my privilege to invite you all. Thank you so much.